Next, we're going to take a look at fabricating a custom fabricated dorsal blocking orthosis. So we're going to take a look at these, and this is, for example, for a flexor tendon injury of various zones. We know that there are 5 flexor tendon zones over the volar aspect of the hand. So what we're going to do today is just take a look at a basic dorsal blocking orthosis. Treating these particular flexor tendon repairs is well beyond the scope of this little instructional video. So you should always know what type of repair, what are the physician-specific recommendations, are you following a modified Duran, are you following a Kleinert protocol, a Washington regime, whatever you might be doing, a short arc motion protocol. So again, just for today's purposes, we're going to fabricate a custom fabricated dorsal blocking orthosis. So today what we're going to take a look at is using a paper towel pattern design for each individual patient. So what we'll do is many times I'll transfer the pattern to the opposite side so I won't put the flexor tendon repair at risk. So I'll take the uninvolved side and create the pattern from the uninvolved hand and then transfer that over to the involved side. So what I'll do is I'll lay the hand flat, I'll lay out 2 paper towels, tape them together, and so what I'm looking for here now is to follow about a 45-degree angle or maybe 1 inch to ½ an inch on the outside of the aspect of the digits. I'll follow all the way around, following the contour of the fingers, along the ulnar styloid, 2/3 the length of the forearm, to the base of the first metacarpal. I'll make a little mark at the CMC joint and at my MP joint and the thumb. I'm not going to show an FPL repair with this, but with an FPL repair, what you may want to do is bring this pattern out here to bring the thumb material over the top to bring that thumb in a protected position in order to protect your flexor pollicis longus tendon repair. So we'll go ahead and lift the hand, and from this position here now I can make my proximal end, round that, and come around that crease. So now I have my pattern. I'll be ready to cut that out and apply that either on the material, or as we'll show in a little bit, use a pre-cut. So now we're going to go ahead and we're going to recheck the uninvolved side. I'm going to place the pattern on the patient at the same time. After we've checked to make sure and ensure the fit of the pattern, we'll move to the involved side and we'll lay this over dorsally over the hand to make sure we have 2/3 the length of the forearm, that the dorsal of this orthosis is going to go beyond at least a ½ an inch above the interphalangeal of the tip of the finger. And I'm going to find my pinch points where I'm going to fold those over in order to make a nice dorsal hood for this orthosis. So now what I'm going to go ahead and do is I'm going to transfer this pattern on the material, and here's what we're using now is light blue Taylor splint. Taylor splint is a nice splinting material that gives good rigidity without a whole lot of significant drape that's going to allow us to give us some support and make a nice supportive orthosis. Apply this pattern. And begin to cut out my pattern right on top of the material. This takes out that step of having to transfer that over. And then we can remove that pattern. Now here we are, we're going to position the patient and yourself for success. I've faced my patient. You can use, for demonstration purposes, we aren't going to use an elevator or a pillow or anything like that at all. What I'm going to do is I'm going to position them in the place I want them here for a dorsal blocking orthosis. From wrist neutral to wrist extension, to some people still actually flex the wrist, maybe 5-10 degrees. I guess it's based on your surgeon's preference. Our MCPs are going to be about 70 to 80 degrees MCP flexion with the interphalangeal joints in an extended position here. So what I'm going to do now is bring the material out of the splint pan. Take the excess water off the material. I'm going to touch the material to the patient's skin. How does that feel? Good. I'm going to roll that over the top, and we should have it just distal to the fingertips. I find my pinch points and I fold those back. That's for my creases for my metacarpal phalangeal joints. Place them in a good position I want them in, and again. And I don't worry too much about these pans folding over the edge. What I'll do is I'll find my, if it's too wide a pan, don't sweat the little stuff. Conform the basic shape of the orthosis. Give them enough finger spread in there. Put them in a position and do the trim job, the trim work afterwards. Sometimes the splint material may have a tendency to migrate a little bit on you, so I make sure you can use an ace bandage or a wrap around here if you like. Just make sure that it doesn't imprint on the material and you don't have it too tight. I'll fold that down, and now it's just a waiting game to ensure the position you're looking for the orthosis. Now we can take the material off and begin to start our trim process. I'll look for 2/3 the length of the forearm. I'll ensure that I'm half the width of the forearm. Trim back any pressure areas and ensure that you don't have too much of a pan on the radial or ulnar border of the digits. You can then refit the orthosis, again to check, to ensure that you have your hand and fingers where you want them to be. It looks pretty good there in that position. Bring her back up. Make one minor adjustment. Don't be afraid to make those changes throughout the whole process. Okay. One thing I want to note again is you may want to make a palmar bar. You can do that multiple ways. You can either place one bar through the palm here and put that together with a piece of Velcro, or you can take a strap sometimes too and run holes through that and then use that to come down for a Kleinert protocol. The majority of what we do is we do either short arc motion based on the tension that we have in the repair, or else we use a modified Duran program. Here's an example. I will restart that, yeah. Again, there's many variations within this orthotic fabricating, different styles and designs, but here's an example of one palmar bar that can be placed around. And we'll take a look at this design here. We'll get it to follow the conform or the contours of the palm, our arches. What we can do is we can pop that off afterwards, and even within this, embed within this material, paper clips, fold those over and run our little eyelets down here to the palm, to the forearm, excuse me, to help track the fingers for a Kleinert program. So very simple to do, and it's easy to modify any dorsal blocking orthosis. Okay. All right, now we're ready to apply our finished product, put the strapping on there. So I'm going to apply the dorsal blocking splint, ensure that's in the proper position. I'll apply my proximal strap. And you can have these pre-cut ahead of time and modify the length as you need. Our wrist strap. Here's our palmar bar if we need to use a palmar bar out of strapping material. And we could place holes through here and use that for a Kleinert, or we could use a regular palmar bar. And then for at night, you can use a dorsal strap along the distal piece to ensure that the fingers are kept within a good position and to counteract any PIP flexion contractures. From this position here, now you can go ahead and remove, whether you're using a modified Duran or whatever you're going to do, and begin to do your range of motion within the confines of the orthosis. Whether it be your short arc motion, ahead and bend your fingers for me. Back up again. Or whether it be your passive range of motion in each one for differential tendon glide. So here we are. This is the basic fabrication of a custom dorsal blocking orthosis. Now that we've created a custom fabricated dorsal blocking orthosis, we're going to take a look at a different pattern and some modifications to this pattern. We've already stated earlier that it's beyond the scope of this little in-service here to determine wrist positions, type of protocols you're going to use. This is just to give you some hands-on time using the material and the various patterns that are needed in order to take care of this type of patient. So now we're going to use a cutout. Okay, and this is a dorsal blocking cutout for the left hand, for the right hand, excuse me. And so there's a couple different ways we can do this. This is the one complete with a palmar bar built in. We could also take that palmar bar, cut that off if we wanted to, and just use that pattern for a cutout for a dorsal blocking orthosis. What we'll do is we'll go ahead and position our patient now, just for standard, so maybe wrist neutral, MCPs flexed 60 to 70 degrees, interphalangeal joints extended. And we'll go ahead and we'll place our material in the splint pan. Now that our material is ready, pull the material from the splint pan, pat off that extra water. We're going to place this as a dorsal design. This is going to wrap around through the hand and tack onto the dorsal border of the wrist. What I'll do in this position is pinch my knuckles, drop those back. Create that pan. And again, to assist, so you don't need as much, you can focus on the dorsal block part, you can use an ACE bandage for the proximal portion in order to ensure a good fit. And again, this is not the optimal position for the therapist. You should be facing the patient, but for your observation, for your ability to see the palmar bar and its fabrication, this is how we'll approach it today. I'll begin to mark where I want to cut. 2/3 the length of the forearm. Make sure my interphalangeal joints are extended. Once the material is dried, you can break this bar off here, pull it along the side, and begin to trim your material back. Go ahead and reapply the orthosis. To ensure proper fit, and we'll go ahead and begin to apply our strapping. So now we go ahead and after we've applied the Velcro, we go ahead and reapply the orthosis. We're going to put on our proximal strap, follow the contour of the forearm. We'll put our 2.5-inch strap at the wrist. A nice little trick with this here is to leave this palmar bar open to get it on and off easier. We'll apply a piece of Velcro here to support that. We just have to be careful that it doesn't pinch the integument, the skin in there. Then we'll go ahead and place our either nighttime or in between exercise dorsal blocking strap on the top of that right there. And there we have an over-the-counter dorsal blocking orthosis. There's many different tips, hacks, and ideas that you can do based on what you're trying to achieve with the patient, whether it be padding the dorsum aspect of the blocking splint, the volar aspect of the strap. And there's your final product. What we want to take a look at also is what particular diagnosis is a dorsal blocking orthosis useful for. Again, the majority of the time it's going to be for your flexor tendon repairs or maybe a tendon transfer based on what the transfer might very well be. And so here's another example of our dorsal blocking orthosis without a palmar bar. Here's an example of our dorsal blocking orthosis with a palmar bar. So everything from your zone 1, 2, 3, 4 flexor tendon repairs in that position. Also, it may very well be to protect the nerve repair. Again, it's based on the type of surgery that you're doing or surgery that has been done, or based on the diagnosis, is very important to ask those questions. And the choice of material may be anything from an 1/8" Tailor splint, easy form, polyflex, some with perforations, whether it be 9%, OptiPerf, or whatever you need in order for airflow for the integument. So those are the type of indications that it may be useful for. And we use these quite frequently in our hand therapy practice for tendon repairs.